Hello, my name is Michael Brooks, the Vice Chairman of the Sullivan County Legislature, and on behalf of our Chairman, Rob Doherty, and the rest of the Sullivan County Legislature, welcome to today's Town Hall event. With us today are our Director of Public Health, Nancy McGraw, our County Manager, Josh Potosik, and our special guest today is Rick Landers. He's a business leader, he's a former town supervisor, and a former school board member. We're going to start today with a few words from Rick, so I'm going to throw it over to Rick. Rick, welcome today. Thank you for joining us.
Thank you very much, and good morning, everyone. And I was asked here to give us a little perspectives on the business community. I run a rafting canoeing business on the Delaware River. We have 3 campgrounds in Sullivan County, and it's been a rough beginning of the year. We usually open up in mid-April, and this year our first weekend was Memorial Day weekend. And it was tough because we followed CDC rules and regulations and teaching our staff and trying to protect everybody plus our staff. I think the education from the CDC and what we had to do was a big change for my business. We started off basically at 25% capacity because at our campgrounds what we did is we had sites between sites. So the groups were were not next to each other and so forth like that. What we did do is we asked, it's mandatory that they wear masks in our store. We have shields to protect our employees. We had only one group at a time in the campground store in order to sign up, and then actually a door to go in and a different door to go out, so the next group, they didn't pass each other on the way in. But it was an education for all of us. And to make the people safe, what we did is with disinfection of our life jackets, our rafts, and canoes. And we did that on a regular basis. Plus, what we did is we disinfected the life jackets, plus we didn't use them for 72 hours. And at 25% capacity, we could afford to do that. On our vans and shuttles, we only did one group at a time. We did not mix groups and so forth like that to make the people feel comfortable. So it was a learning experience for all of us. And I think it was going to be a tough year for us also because a lot of the local camps are closed. In other words, several of the camps, like 10 Mile River Boy Scout Camp is going to be closed this year. LaConda is going to be closed, and a lot of other camps that we do. And in the summer, we do a lot of camps, and they come with buses and buses of people, and it really hurts the economy. And I think what makes me feel the worst is a lot of our college kids won't have jobs this summer. And they use that to use for their colleges and so forth like that. It's going to be hard economically for them. And I think there's going to be a lot of businesses because what we do at our campground also affects the local grocery stores, the convenience stores, the gas stations, the liquor stores, and so forth. I know they're already hurting to a certain capacity on that. But we're hoping that it will get back to normal and so forth as soon as possible. I will say that the people that we've had here already this year have had a great time, and they are very respectful. They do follow the CDC rules. They do wear the mask in the vans and in the buildings, and it's been a pleasant experience as far as the customers because they know we're going out of our way for them, and they have been very nice and cordial among each other. So I think it's been a very safe thing. And to be perfectly honest, I think small business and mom and pops do a better job than Walmart does. And I think we're safer opening up the small businesses to the people. So, I've been born and raised in Sullivan County, and I love it and respect it, but we need to get open.
Thank you, Rick. Rick is a prime example of someone, like you said, he was born and raised here, has a business here, been involved in the community for many years, and it's a typical voice in Sullivan County. And there's so many small businesses that are hurting, potentially may not open, and there's a saying that if a small business dies, everyone pays for their funeral because it's such an integral part of our community. And thank you, Rick, for joining us today and sharing what you're going through and how tough it is. And early on when we had these meetings, I made a comment that, the virus is adaptable. And I also mentioned that we as people are also adaptable. And you can see it's on display across the country, right here in Sullivan County. We do things to keep moving forward. So with that being said, we're going to go to our Q&A session. And the first few questions are going to be for Nancy. So we'll start off like we always do. What are the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested? Nancy, welcome today.
Good afternoon. I hope everybody had a nice weekend. Welcome to Rick Landers. We're very excited, I think, to be getting back out on the river. Delaware River is, right near my home, so we're all very excited for that. Over the weekend, we continue to see single digits in terms of the number of new cases, so that is a good thing. We're continuing to monitor. So we are up to 1,370 confirmed cases. That's only an additional number of 12 over a period of 3 days. We have 220 active cases that we're following. That's a drop in about 6 from last Friday. 786 are in mandatory quarantine, which is also fewer. 2,610 have recovered and are off of isolation. And 15 are currently hospitalized at Catskill Regional Medical Center, which is also lower, with only 1 person on a ventilator currently. And total number of people who have been tested are 8,116. Last week we had a testing clinic in Liberty, and we tested 47 individuals, and there were no confirmed cases from that testing clinic, so that is good news.
Excellent. The next question is also for Nancy. Rumors. There's all kinds of rumors. Rumors are rampant that Catskill Regional Medical Center is overcrowded with summer visitors. Is that true or false?
That is currently false. We have weekly conference calls with the hospital through the Emergency Operations Center, and in between if necessary, so that we can keep in touch and keep the pulse on what's happening at the hospital. And we get daily reports in terms of the called HERD surveys, which are the Health Electronic Reporting Data System. So actually the number of visits in the emergency room seems to be a little bit lower than is normal this time of year. There can be ebbs and flows depending on what's happening in the community. Overall, 37% of their beds are currently open, and they're at the lowest number of hospitalizations for COVID-19 since the beginning of April. So that's good.
Thank you, Nancy. Next question is for you as well, and it's a long one. How can out-of-county residents who have COVID or are on isolation or in isolation, quarantine, and are here in Sullivan County be reflected in Sullivan statistics to either allay or confirm the fears of residents while raising the consciousness of the Department of Health as to the potentially negative impact on vacationers on an already vulnerable health situation?
So I've addressed this issue a couple of different times before, and I think the concern in the question comes from a general concern about the number of visitors increasing, and at the same time, what is our potential for an increased risk? So currently, as the system works, we are part of a statewide rollout of ComCare system, which will be going live in a few weeks for the Mid-Hudson region. And we're working to see how we can get data in terms of anyone who's coming here to Sullivan County who may test positive, and collect that data and work in cooperation with the hospital and with our healthcare providers to collect both primary and secondary residents. So those are 2 areas where we're looking at. But I just want to underscore and stress the comments that I've made before about anybody who's currently testing positive and is either a positive case and on an isolation order from their county of residence or is in quarantine, is confined to their home and they should not be leaving or traveling. So I'm not concerned about that. I think the question is if, once somebody gets here, should they become sick and get tested, they would also be isolated and we would be aware of that case. So I want to make sure that people understand that there is a monitoring process that does occur for both full-time residents and visitors.
Thank you, Nancy. And I have another question for you, and it reads, Nancy McGraw was present at a Zoom meeting on Saturday evening which addressed issues among our minority essential workers. At the time, it was noted that those who work in the bungalow colonies are exposed to large crowds of families who do not use face masks or other PPE. What steps are going to be taken to protect these folks, who often do not have adequate medical insurance or unemployment insurance?
As anybody who has been watching the town hall meetings or reading some of the information that we've been putting out, you may be aware that we've been working very hard to reach out to underserved communities and communities that are higher risk due to the COVID-19, and to help them with education and providing face masks and to help them protect themselves. So we've had testing clinics within walking distance of communities where people commonly live and work and don't have transportation or health insurance. And through our emergency response side, we've worked to get Spanish language messages out to the community with everything from Zoom meetings to social media and outreach through rural migrant ministries and also the business owners and employers of those populations. So the Emergency Community Assistance Center has distributed thousands of masks to communities of color and to those in high-risk occupations. And in addition to their primary mission to ensure that anybody who needs food and cannot access it because they're on isolation and quarantine are able to get that. So as a county, we've really worked quite collaboratively with a lot of different groups to make sure that everyone is protected. We will continue to do so, as we see an increase in visitors, and I know there's concerns about some of the bungalow colonies, and should the camps open, there will be certain requirements and a safety plan, and we're working to communicate with all of our visitors and residents to make sure that everybody has what they need to stay safe. I want to just address briefly an issue that came up and a question that came up about Sullivan County's infection rate in a recent New York Times article indicating that we had one of the highest per capita infection rates of those testing positive for COVID-19. The article did not specifically reference the data source that was taken from, and I've taken a look at a variety of different sources. So I can say that two things. One is that our daily rate of those who test positive in comparison to those who are getting tested is really in alignment with a lot of other counties. And if you look on the state's dashboard for COVID-19, we are a little bit darker, but we're by far not the highest per capita rate in the state. So we range anywhere from 16 to 23% of those who are testing positive. I think that what one needs to keep in mind is that when we're talking about statistics and rates, whenever you have small numbers and a small population size, your rate is going to have less reliability when you compare it to other parts of the state. For example, Long Island and the Bronx, where there's millions of people. So keep that in mind in terms of the incidence and rates, because that information can be a little bit misleading.
Thank you, Nancy. And now we have a few questions for Josh. And the first one is Sullivan County still on track to meet Phase 2 next week? Josh, welcome.
Good afternoon. Good afternoon, everyone. Thanks, Mike. So currently, as we've discussed before, Sullivan County is part of the Mid-Hudson region, and when we're talking about going from Phase 1 to Phase 2, we're going to do that as a region, not as a county specifically. But the regional data has been trending in the correct direction. We've met all 7 of the metrics that we needed to open in Phase 1. Those metrics are all still green, which is a good sign, and even trending in the right direction generally. So yeah, we fully feel in the control room that I'm part of fully feels that we'll likely be going to Phase 2 early next week, technically June 9th. So that's the hope. Next Tuesday, June 9th, we'll be in Phase 2.
Thank you, Josh. Next question for Josh as well. When and in which phase do you anticipate the care center will reopen to visitors and new admissions?
That's a good question. I don't think anyone has a crystal ball here today to know exactly when that will happen. And from a technical perspective, I think we're not going to be looking at medical facilities, even though they are a business, opening in certain phases, whether they be 3, 4, or afterwards. Those are going to get regulated and decisions will be made outside of the phase reopening. If you're looking at where it would fall in the phases, probably most likely Phase 4, if you were looking at it and they were going to open by a phase. But I think just due to the special nature and the vulnerability of that population, I think that's going to be something the state's going to be looking at separately and independent of the actual phase reopening. So it could be Phase 4 or even after, depending on what we're seeing in the nursing homes in our region, but across the state.
Okay, next question for you, Josh. How is Sullivan County educating businesses on the proper ways to reopen, including masks, gloves, disinfectants, and social distancing?
So the county created a recovery working group that includes county staff, planning department, and our external economic development partners, IDA, Partnership, SCVA, Chamber, and we've included Cornell Cooperative Extension to help with our agricultural businesses. But their main goal is to kind of share information and connect local businesses with tools that they need to be able to reopen safely in an effective manner. A lot of information just for the general public outside of the question is that the state is posting business-specific guidance almost daily through their state site or the the ESD site, Empire State Development. So if you're unable to get into contact with one of the local partners, the websites do have a lot of information, guidance on how to reopen your specific business safely.
Okay, and the last question for Josh is, if police have no power to enforce these provisions, how can we be assured we're safe when we visit these businesses?
Again, tying in so every business is required to have, that's in the phase reopening, is required to have a business plan, so to speak, of how they're going to protect both employees but also the customers coming into their facilities. So you are able to ask for one of those. They're supposed to be publicly available, and you can review those plans if you're concerned that a business is not operating how you feel they should be operating. But we are, there's the hotline through the state website that we are still fielding calls if a member of the public feels there's something that's not compliant with the either CDC or executive orders. We are following up on those. Like, as we've discussed before, the vast majority of businesses or people congregating, when they are made aware of the rules and regulations, come into compliance pretty quickly. So we haven't really had many issues where it's had to get to law enforcement action. If you've heard the governor, and even they are able to, at a state level, if they become aware and there's repeated violations, can pull business licenses and such. We are not aware of that happening in our county today because most businesses want to be safe and want to protect their employees and customers, so they are generally compliant.
Thank you, Josh. And as our guest today, Rick Landers, mentioned, he went through what he's been doing with his business to be safe, CDC guidelines, so on and so forth. So it's, as we move through these phases, it's always, there's a personal choice. If you do not, as we've seen overwhelmingly, people want to get back to work. It's important we get back to work, and I think overwhelmingly the business owners will do what they need to do to keep their patrons safe. It's always a personal choice. If you if you want to go into a business or not, but it's I've been it's been amazing to see how many people want to get open and they want to do the right thing, because we're all in this together as a county. So we have one last question, and this is for Nancy. Is the measles order from last year still in force? What does that do?
Yes, the camps that they're allowed to open, and we're talking about children's camps, which is a state health department decision. All the campers and all the staff will have to provide proof of immunity to the measles, mumps, and rubella, to measles, or a titer to be allowed to participate in entering camp. The legislature renewed the 2019 measles order for Sullivan County, and that is in effect for 2020 as well. One last thing that I wanted to go over regarding some updated news that we have received is regarding time periods for isolation when somebody tests positive for COVID-19. On Saturday, May 30th, local health departments received updated guidance from the New York State Health Department, which supersedes its guidance issued on March 28th about when those who are infected with COVID-19 can be released from home isolation. The new guidance more closely aligns with the current CDC guidance, Centers for Disease Control, and is 10 days after the onset of illness and at least 3 days or 72 hours after recovery. Recovery is defined as resolution of fever without the use of fever-reducing medication and with progressive improvement or resolution of other symptoms. This does not apply, however, to settings such as nursing homes, assisted living facilities, or adult care facilities. And those are congregate settings with high-risk individuals who are most at risk. So the 10 days, as opposed to previously 14 days, is the guidance we will continue to follow now with this updated New York State guidance. And the reason why it is being revised is because of the evolving research, of course, with this ongoing research and with the novel coronavirus. So at this time, the virus has not been successfully cultured for more than 9 days after the onset of illness. Therefore, they're agreeing and updating their guidance that we can release people who are testing positive on the 10th, after 10 days. And with that caveat of 3 days fever-free and improvement of symptoms. So that's a little bit of good news for folks who thought they would be on isolation for 14 days.
Thank you for that update, Nancy. And that does it for the questions today. So I'd like to thank Nancy McGraw once again, and Josh Potosik, and our guest Rick Landers for joining us today. And I want to mention the census again. We still are running behind on people filling them out. So please, it's so important that you fill out the census for the county in which you live. And it's heartening to look at the numbers and see them going down. Just seeing that 15 hospitalized and 1 person on a ventilator. Certainly we don't want anybody, but the numbers are going down dramatically, and it's a good feeling to see that. And with the information that Nancy just shared, as we know more and more about this, we're going to move through these phases. Personal responsibility is always at the forefront. Do the right thing. We'll get through this together, and I know I'm looking forward to seeing some businesses open, people patronizing the businesses, and because it's so important. A lot of people suffering, and I, for one, it's good to hear that our numbers are at a point now where we can think about opening. So with that being said, everybody be safe, have a good afternoon, bye for now.